What if the secret to better asthma outcomes isn't just in the clinic, but right there in the community? Hi, guys. Welcome back to RTs Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the asthma lady. Yes. Welcome, everyone. Welcome to anyone new. And today I am very excited because I have another amazing guest co host, Ms. Traci Hardin. Yes. So, let me kick that out. Okay. So, with what I'm going to do is read Tracy's bio, guys, so you guys can fully understand what she does in the asthma space. So, today's episode, we're really going to dive into community health workers in regards to asthma management. And Tracy has a plethora of knowledge around this topic. So that's why I'm so excited to have her here today. So I'm going to read her bio, read her accolades, and then we're going to let Tracy take over the show. Yes. All right, guys. So, okay, make sure I get this right. Traci Hardin holds a Master's of Public Health degree in Health Promotion and Education from the University of South Carolina and is a certified asthma educator. Since 1997, she has been educating parents, caregivers, and professionals on effective asthma management while working in both the managed care and nonprofit sectors. Tracy established her own business, Breathe Well SC LLC, to further her mission of integrating public health principles with best practices in asthma management for allied health professionals and caregivers of children with asthma. Tracy has had the privilege of conducting asthma training sessions at local, state, and national levels. Among her most notable achievements are her roles as board chair for the South Carolina Asthma Alliance, board member of the Association of Asthma Educators, chair of the AAE's Community Service Project, and co-lead in the development of the AAE's training curriculum, asthma education for the community health worker. With over 20 years of experience, Tracy has been a strong ally for community health workers, supervising and training them in South Carolina and beyond. She now proudly holds the title of community health worker herself. Yes. Yay, Tracy. I'm so happy to hear that. Okay, you made it official.
Yes.
Yes, yes. All right, guys. So, Tracy, well, you know what? The first thing we're gonna do is just give us your definition of what a community health worker is for those of us that are clinicians and in spaces where we don't interact with community health workers often. But give us that, what a community worker is, what they do, and then let us know what inspired your journey to work alongside community health workers, and how did you first begin to see their impact in asthma management?
All
Yes.
right. So the definition of a community health worker is it can be kind of two to three different ways, but the
Mm-hmm.
way I like to define community health workers are these are the folks that are boots on the ground.
Mm-hmm.
They are in the community
Yes.
and working alongside of patients or community members,
Mm-hmm.
whether it's helping them go to get in with their primary care provider instead of overutilizing the ER,
Mm-hmm.
um, doing home visitation to see what kind of issues they're having, that's keeping them from being healthy,
Hmm.
and trying to connect them to resources. But, basically, they're the ones that kind of tie everything together, and
Yes.
kind of are the middle ground between the patient and the medical provider. That's how I see a community health worker.
I
Yeah.
love that. It
Yeah.
definitely, because I felt like when I came into my space of working in the asthma program, when I took the role of the director role in 2014, the on my team, I had public health educators, I had senior analysis, and I had community health worker. And that
Okay.
was the one that I had the question mark. I was like,
Yeah, like,
what is
yeah,
that? Yes, but I once I got to work with them and I knew what they did, I said, this is amazing. Very useful for us making, like you said, the connections between the hospital space,
yes,
community space. Yes, yes,
exactly.
yes. So
Exactly.
so keep going. Let us know, how did you your journey into this space? How did
Yeah, it's really a neat story. I started out basically getting thrown into asthma education,
okay.
in my public health journey, and ended up working in the for-profit sector, managed care,
Okay.
for several years, and really learned so much in that sector, but felt like something was missing. Something wasn't, just on the phone with folks, helping them was very rewarding, but I knew I could do more.
Okay.
And one day I'll never forget, I was in a meeting with this wonderful lady with a ton of energy that was talking about her community-based organization in
Okay.
South Carolina that supports families that have children with special health care needs. And she was coming to talk to us about the program they were just starting for parents of children with asthma, and just really excited and talking about how they hire parents of children with asthma and plan to train them on how to give
Mm.
support and asthma education, basic education to the
Okay.
families to help meet their needs. And I'm like, I want to be a part of that.
Mm-hmm.
So funny enough, I kind of kept in touch with her, and it took about, I don't remember if it was 6 months or a year later, but
Mm-hmm.
I ended up going to work for them.
Oh, okay.
And
Nice.
yeah, yeah, I changed into the from the for-profit to community-based work,
Okay.
grassroots, I love to call it.
Mm-hmm.
And that was my jam, basically.
Mm-hmm.
That what
Yes.
I realized very quickly, what a feel good kind of job that
Yes.
the parent educators had. And early on in this, I was doing home visitation,
Okay.
and building the program and hiring parents of children with asthma, and training them. And um, it was just amazing what could happen, um, with a little bit of support and
Right.
empowerment. And
Right.
yeah, and
Compassion,
encouragement.
encouragement.
Yes,
Yes.
yes.
Mm-hmm.
What, could change the trajectory, I guess, of their asthma management. And I just realized very quickly that community health workers they come in different shapes and forms.
Correct.
These were parent educators, and they just made a huge difference
Mm-hmm.
in the lives of the people that they were working with.
Okay.
So yeah, that's how I did that, and for many years, worked with Family Connection of South Carolina is the name of the organization.
Okay.
Um, yeah, worked and built their program up statewide.
Excellent.
Yeah, so that's how
Excellent.
I got started. Yeah.
I love the fact that you mentioned the fact that you started with with parents,
Yes.
so, and just stating that they come from all walks of life, right?
Yes.
So this is
Yes.
something that I also had to learn about community health workers. Like, what is their like standard of care, and having to just know that everyone is not starting from the same place, but
Right.
the heart is there. Like you said,
Yes.
like the passion is there, the heart, the wanting to help, boots
Yes.
on the ground, like they that is not an easy job to do. That's what I've
No,
I've learned actually.
it's
That is
not,
not easy.
because the community health worker is all about building trust
Yes.
in the community. And that
Yes.
takes time
It takes time.
and it takes a lot of being
Patience.
there,
Yes.
just being there. And, that's what I love about being a community health worker is you get to meet people where they are,
Mm-hmm.
and kind of go from there. It's
Mm-hmm.
not all about, for me, I made the mistake early on in my asthma education career in thinking, okay, I got to teach this. They
Right.
need to know everything,
Everything.
and I've got to get that across. But then I learned if you just meet people where they are, and
Mm-hmm.
that's what community health workers are so good at,
Right.
you build trust, and then you can build that information,
Mm-hmm.
and help people with what their immediate needs are.
Yes, I love that. And I want to say you just answered my next question.
Okay. Yeah, I may have
So which
jumped
is
ahead a little
good.
bit.
No, 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 that's good because this is a real convo. So I
Yeah, yep.
I I understand what you're talking about really, and just understanding the possible community health workers being the link
Yes.
of between us, healthcare providers, clinicians, and the community, and how they're able to do that. And you
Yes.
totally just said that is the trust. So, and just like I do, how high risk areas, there's a a history of distrust
Distrust.
with with the healthcare system.
Yes.
And and to me, this is where having community health workers on the team is like everything,
Yep.
because they get it. They know they are the mirror of the community.
Yeah.
You know what I'm
Yeah.
saying?
Absolutely. That I love that. The mirror of the community. That's exactly right. And the what I see probably one of the biggest assets that the community health worker can bring is helping to identify those barriers
Yes.
that are keeping folks from having ultimate or optimal health.
Mm-hmm. I think
And
so.
you're right, living in underserved areas, impoverished areas, whatever you want to call them,
Yeah.
it's tough.
It's what's one of the hardest, from what I my experience is one of the hardest communities to connect with, actually, because once again of that distrust, and because there's so many onion layers of issues, social,
Oh my gosh, yes.
economical, it's so
Yes.
much. And you almost don't know, and then in the clinical space, oftentimes we tend to think like, oh, this person is not adherent.
Right.
Oh, it's about the medication. They're not showing up to the appointments because they don't feel like it. And having the public health eye, once I got that,
Yep.
it really did open my eyes, because I only knew what I knew from the clinical space, just being in
Right.
the ER and inpatient units and whatnot. So,
Mhm.
yeah, definitely eye opening.
It is. It really is. To the bigger picture.
Yes.
There's so much more. I love the peeling the onion away. Yeah.
Hmm.
Yeah.
Okay, so now let's talk about training and collaboration.
Okay.
And fun fact, the way that I even got to know your name, you probably didn't know who I was, but I knew your name because I have seen when I had to look for things to help train community health workers, because remember I told you I had some of my team, and I was like,
Right.
okay, how can I train them in asthma education and being able to break it down appropriately for
Yeah.
them?
Yeah.
Your name started popping up, right? So I was like, oh, okay. And it's so sometimes it's so like wild how life kind of, and then I started bumping into you in
I
asthma
know.
space. It's
Yes.
so, yeah. So, okay. So you help co-create the Association of Asthma Educators Asthma Education for the Community Health Workers curriculum, which I had, by the way.
Yeah.
What core skills or knowledge do community health workers gain from this training? So what did you think they needed and what do they get?
Yeah, so the program is really comprehensive on the core asthma basics.
Okay.
So we train community health workers on the ability to give their asthma spiel, I like to say. We teach
Mhm.
them how, in a very basic way, to explain what's going on with asthma.
Okay.
Um, So that's kind of module one.
Okay.
Um, Module two, we definitely get into asthma triggers and
Okay.
ways to eliminate, reduce, or avoid
Mhm. Avoid.
exposure. We spend a lot of time on that
Okay.
because that's a really
Yeah,
important piece, that
it is.
especially if they're going into the
The
homes,
home.
they
Hmm.
can have an impact, right? So then we get into medication management, and we
Okay.
really focus our attention on training them to understand the difference between long-term controller meds and quick relievers. So
Gotcha.
we're not getting into a
The
lot of
right.
clinical
Oh
information.
yeah. And it's so
Yeah,
much.
that's
So
right.
much.
It's too much. And you got to start at the beginning anyway.
Correct. Correct.
So we spend time talking about the importance of long-term controllers and
Hmm.
ways to reduce barriers for them using the long-term controllers. Again, going back to what I said
Hmm.
about CHWs having the ability to identify
The
barriers.
barriers. Hmm.
Um, so that's another thing that we teach. We definitely teach proper technique of the meter
Okay.
dose inhaler with a chamber.
Hmm.
And we teach them about dry powder inhalers and the differences in how you breathe in versus the meter dose inhalers.
Hmm.
We touch on nebulizers as well. And then we wrap up the training with assessment and monitoring. So
Okay.
we educate them on the goal is for them to understand how important the written asthma action plan is.
Excellent.
So,
Okay.
we kind of start from the beginning of what asthma is and kind of wrap it up with, well, here is the tool that everybody with
Yes.
asthma should have that takes the guesswork out of what to do with their asthma on a daily basis. That's the way I
Right.
always describe it.
Yes. And
Yeah.
for me, also like them even knowing that they can use that as a teaching tool, like even how
Yes,
to start, a conversation. If someone
absolutely.
has an asthma action plan or don't have an asthma action plan,
Uh-huh.
they can, that can kind of start the whole convo or the journey
Conversation.
or the,
Yes. And we talk
love it.
about rules of two and,
Mm-hmm.
using tools like the asthma control test or the air
Yes.
cue to help it, get folks thinking, is my asthma under
Under
good control?
control.
Yep.
The $100 question.
Yes.
That's
Yes.
a big one. So yes, so with that being said, how has this training elevated community health workers' confidence or, their credibility
Yeah.
with their roles in different settings?
So two things. one, you earn a certificate of completion from this national organization, the Association of Asthma Educators.
Excellent.
But you don't just get it for taking the course. We're unique in that we actually test, or I like
Mm-hmm.
to call it the final assessment.
Mm-hmm.
Test scares the bejesus out of most people.
Right.
Um, so I like to try to make it sound not quite as bad, but we assess how well each person that went through the training um, comprehended the material and are able to explain it to us. So
Right.
it's an
Okay.
oral assessment.
Okay.
Yeah, and we just have a conversation with them. So that's what makes this unique in giving
Excellent.
the community health worker the confidence. Hey, I know this,
Mm-hmm.
or I need to work on this a little
Tweak
bit
this
more.
up. Mm-hmm.
Yeah,
Okay.
yeah. And we, during that assessment, there's teachable moments one on one.
Right, right. Because you said
Yeah,
it's oral, so you can give feedback right
yeah.
then and there.
Feedback. And we chat about, more
Mm-hmm.
detail if they're not quite getting that particular concept. But they do, if they have to pass with an 80%
Okay.
understanding or better to earn that certificate of completion from the AAE. And I really feel that that makes them more, and yeah, the word credible,
Mm-hmm.
because
Yeah.
the definitely the medical community is a
Yes.
little leery.
Right.
There's the elephant in the room of
Yes.
a non-clinician teaching about asthma. And we feel like that this training really elevates their knowledge
Mm-hmm.
and credibility once they
Excellent.
complete the training.
Yes. Yes, yes, yes. I totally agree. Because like you said, especially in the hospital, we know that it's just so much information, and
Yeah.
we want to make sure that this individual can break down the information at least in a way where the patient has a grasp of it, and they're not
Yeah.
saying anything wild. Like, we want
No,
to make
right.
sure, it's not coming from random places. Like, this is evidence based.
Right.
Like,
And I didn't say that, but everything that we do is based on the national guidelines and the
excellent.
GINA guidelines.
Mm-hmm.
So they're learning from the same, resources that the medical community is learning from. They're just learning it on a basic
Yes,
level.
which is necessary.
It is
Which is
necessary.
necessary. And I mean, I don't know if this will ever happen, but I've also mentioned, I think that the certified asthma educator exam, I feel like there should be a different track for them. It's
I
it's
know.
really hard. And I have a few community health workers that I know have attempted to take the exam. We have give them the prep courses, and it's still hard to pass because a lot of them, English is a second
Oh,
language.
yeah. That's
it's
really
it's
hard.
just tough. But like you said, I like what you're talking about because it still gives something to show that they are credible. They have the
Yes.
knowledge, and they have invested their time. You know what I'm saying?
Yeah.
So that's good to know.
And I
Absolutely.
wanted to mention, I know we were going to talk about those community health workers that may be listening that want to sit for that certification exam. And I just want to encourage them, do
Hmm.
it, do
Yes.
it, do it, do
I
it.
tell them, go for it. Don't let it scare you.
Yes.
I just, and so I tell folks, sometimes you have to fight for what you want. And me, I am a respiratory therapist. I took that exam twice myself.
Yes.
I know nurses, I know residents, I know
Yes.
PAs that have taken that exam more than once because the for clinicians, I think we're like, oh, asthma, psh,
Right.
bread and butter. You really have to know how to take that exam, though. It's not,
You
it's
do. And what I tell everybody, the only way I
not
passed it
easy.
was because I used my educator hat
Right,
and
right.
thought as an educator, I had to know the clinical pieces,
Mm-hmm.
which I learned through taking the prep course,
Mm-hmm.
through
Mm-hmm.
studying the rubric that they offer.
Right.
I even shadowed a doctor.
Okay.
I found I got made, connections in the community
Mm-hmm.
and shadowed an allergist one day,
Okay.
and watched pulmonary function testing,
All
which is
right.
a little scary for those of us that aren't in the clinical,
Right.
setting, and kind of really picked his brain and the nurse's brain
Wow.
about things. And I think that's what helped me pass the test.
Mm-hmm.
I really
Excellent.
do. And if I can do it, anybody can do it.
I'm telling you. Yeah, I totally agree because
Yeah,
that
it is
exam,
intimidating.
not it's not an easy one, but it's passable once you know
Yes, it is.
how to take the exam and you
Take
have
it.
the resources, take it. I tell folks do
Hmm.
it. Okay, good. This is really good. What advice do you have for asthma educators and respiratory therapists, anyone in the health field who want to partner effectively with community health workers? Like, what
You
advice would you
know,
have?
I was thinking about that, and I think the biggest thing is just to give respect to what
Mm,
it takes to be a community health worker. It is not a
it's not
9 to 5
easy.
job.
It's not easy.
And you're not sitting behind a desk on the phone.
Right.
You're in the
The
community.
house, you're in the community.
It may be in
Oh,
the evenings, it
oh
may
my
be in the
gosh.
mornings, it
In
may
the
be in the afternoon.
snow.
Yes.
Okay, in
Yes.
the rain.
And yeah, a lot of folks that I've worked alongside of doing, they were doing different programs. They didn't understand, why isn't that community health worker in the office today? Why aren't they
Hmm.
here? Why don't we see them? I'm like, it's because they're doing their job. They are in the community where they're making relationships
Mm-hmm. That
and
trust you were talking
attending,
about.
yeah,
Yeah.
developing that trust. So I think that's the one thing, that's the advice I give to the medical community that want to utilize community health workers in the asthma care team
Oh,
is
yes.
they have to work differently, a little
Correct.
differently.
Correct. It's not. And I also had to, in my own role as the asthma program director, I had to speak up off the time for them
Yes.
because it's like, yeah, it's not a desk job. So I
No.
also had to be like, yeah, well, that they're outside. Like, where are they? Like you said, like,
Uh-huh.
where are they? And I'm like, oh, they're at a patient's home, or they
Yes.
had to deliver something to a patient who could not come to the hospital.
Right.
How about that? How about I one time I had one of my staff who was a community health worker. They got lice because they sat while they were talking to, yeah,
Oh
it's
no.
not an easy job.
No, it's not.
It's not
No,
an
it's
easy
not.
job.
But it is,
Safety.
yeah, safety.
I'm Mama Bear, so I let them know, listen, your safety is your number one, no, my number one thing for you
Yes.
guys.
Yes.
If, and we have to consider those things. Folks are getting into elevators with supplies and, it's not an easy job.
It's not. It's
I
not.
valued them so much. It was such a rewarding for me to work with community health workers, train them, have them as part of the team, and I call them the eyes and the ears of the hospital because you
Yeah.
don't know, you never know what's going on in someone's home.
Right. Right. And
Cool.
they're more than people are going to open up to community health workers
Yes,
if they do their job right, which is, like we said, is not, it
it's
takes
a
time,
skill. Mm-hmm.
but they will open up to them way better then they
Mm-hmm.
open up to the clinicians
Yes.
who doesn't
Oh,
get to
that's a
spend
fact.
much time with them.
Oh.
It doesn't mean that clinicians aren't doing their job right.
Mm-mm.
They're doing a great job. They just have a small amount of time to make an
Correct.
impact.
15 minutes, if that. If that. And
Yeah,
to even think about, imagine you're going over medications,
yeah.
okay, medications, asthma action plans, everything. And
Triggers,
then
whatever. Yeah.
it triggers. And then the patient says, hey, I don't know where my next meal is going to come from. Who's a, like,
That's exactly what I was going to talk about
it's a
also.
lot.
Yeah, those
It's
social determinants of
of
health, we
health.
like in public health to call it.
Oh my gosh.
They're critical. You've got to meet those needs
Yes.
first.
Yes. It does.
You-
I can be as good. It doesn't matter how much inhaler technique,
Right.
how if at the end of the day you walk out the hospital, you go home, and you cannot find food to eat.
Yeah, that's all that matters.
That's all. Everything I we just spoke about out the window.
Yeah.
Everything
Yeah.
that I taught you.
Yeah.
It's a fact.
So community health workers have to know a lot about a lot.
Yes.
They
Yeah.
really do.
Oh
There's
yeah.
quite a learning curve
Yes.
to be a
Yes.
community health worker, and that takes time and experience
Mm-hmm.
to be a seasoned person that really knows how to connect in the community.
Yes, yes. And connection. I always say this. I get it from Oprah Winfrey. Like great communication comes from connection.
Yes.
If there's no connection, they're not even receiving
Yeah,
most of what
right.
you're saying. So and I think that's the disconnect between the healthcare system sometimes, a lot of the times, and patients. It's just that lack of connection. And like you said, it's not because clinicians are not doing a great job or they're not um nice people or whatever. It's just sometimes
Right.
you just have to put that extra work in to get the
Yeah.
trust, build that trust and rapport, and then they will start to take your, advice, treatment plans. They adhere to those. So great. This is great because you've already answered my questions on right future encouraging community health workers to take the certified asthma exam.
Yes, definitely.
They're scared. I know a few that, this is scary, and but you just gave the how to encourage them to go for it,
Yeah.
and that they should totally go for it.
Absolutely. It's definitely worth it. It made me want to be a better asthma educator just by taking that exam and studying
Mm-hmm.
for it. It elevated everything.
Mm-hmm. Yeah.
And it also, it is a good thing to have because if you're not a clinician, um, everybody kind of started looking at me differently once I got my certification.
Mm-hmm.
And
I
I
know.
get it. I
We
get
get
it.
it. We get it. Yes, because
Yeah.
um once again, um that's not an easy exam to pass.
Nope.
So that means you are invested. That's what I see when folks go after those credentials when they really want them
Yeah.
and you have them. I see investment, and
Yes.
and I like it.
Absolutely.
Um, yes. Okay. So, what is your vision for the
Mm.
future of community health workers and asthma educators collaborating, especially in communities most affected by asthma disparities? So, where do you think we're headed? I mean, you see, well, I'm not a politics person, but we see what it is right now. So,
Yeah.
so what do
Yeah. It's
you?
tough. Public health right now is a tough area to be in.
It's
Um, and
the scary
yeah,
right now. Scary.
exactly. And that's where my phrase that I always use, it's not my phrase, I took it. It takes a village.
Right.
It
Right.
really does. And a team effort to manage asthma, especially with folks in underserved areas.
Yes.
Um,
Children. Yeah.
yes, oh, those children just, they're my heart.
Yeah.
They are my heart.
Yes.
Um, but it is important that we all work together
Yeah.
to do the different pieces, pulling all of them together to help manage asthma effectively. One person, it's really hard to do it alone. That's why teaming up with a community health worker can have such a just a bigger
Hmm.
impact.
Yes. Massive.
And yeah, yeah, and keeping asthma, so the patient can take control of their asthma
Hmm.
instead of asthma taking control of
Control
them.
of them.
And
Yes.
we know that's what we all want to happen. Um, but it's just, yeah, the team approach is the only way I think we're going to succeed.
I love that. When I do speak to, when I do public speaking on
Mhm.
anything asthma related, I usually do also encourage other clinicians, other, doctors, to support those roles.
Yes.
Like, they don't even understand sometimes how much roles like community health workers, navigators, help bridge those gaps that we've been talking about, the eyes and the ears,
Yeah.
what's going on in the home. So I'm like, fight for them, because like we said, once again, sometime when funding get cut, it's
Yeah.
happened to me.
That's the
Who,
first thing.
they try to go for that, and I fought so hard for my team, and so I know firsthand how it is. It's like, oh, we have less funding, we have to let some people go, and I'm like, not my community health workers.
Yeah,
Mm-mm. We
they're
need them.
essential.
Yeah, oh
The
yes.
essential workers,
Oh
those community
yes.
health workers are essential.
What?
They are.
Okay, absolutely for them. Tracy, I love this conversation. Thank you so much for sharing your insights, opening our eyes into the world of the community health worker, letting us know what they do, and like you said, just letting us know how to support them and how to work with them, and just having them be a part of our world and our team. So this is your time to plug away. How can people find you? What do you have going on? Plug, plug, plug.
Okay. The biggest thing I want to plug is the AAE's community health worker training.
Yes.
That is at the forefront of my brain always.
Yes. I will
And
put that in the description as well. I'll put it.
yeah,
Mhm.
yeah, just if you want to get trained on asthma, um, just reach out to the Association of Asthma Educators.
Mhm.
It is a group training, so but we have been offering it. This 2025 has been an incredible year for us. We've
Mhm.
had the training once a month, um,
Excellent. It's necessary.
which yeah, is just huge. It's
Yes.
huge. So usually we have an offering each month that you can join. So find out more about that by visiting the website. And I mean, that's where you find me. That
Okay.
I'll be there supporting the association's efforts and just
Yes.
doing everything that I can. We just did an update on the curriculum. Uh,
Okay.
yeah, we gave it a brand new look and
Mhm.
added some more material. We
Okay.
added what I'm really excited too about is I don't know if you've had Al Keith on
Yeah.
your. I
I
thought
know.
you did with
I know.
his music with a message that matters. We actually partnered with him
Okay.
and are
We
utilizing
love
his
that.
music in the
Mm-hmm.
training to help
Excellent.
solidify concepts. And then he's also kind of gifted some of his songs to the CHWs so they can take it and use it when they're training.
I love it.
So a lot of exciting stuff. A lot of exciting stuff going on within the CHW asthma training
Excellent.
initiative. So yeah, just you can get in contact with me through the AAE.
All right.
If you have any questions, want to know more about how to get trained, and I'll set you up.
Oh yes. Tracy is always, she just makes herself available. So I love, and when we first met, I was like, girl, I felt like I knew you already. I was like,
I felt the same way.
I
I
like, you know what?
remember at
I'm
the
a hugger.
conference.
I'm
Yes.
yeah. I'm like, I'm a hugger. You know, like I said, I recognize the name. Good
And I
vibes.
recognized your name. So it was mutual. It was
Right.
mutual.
Tracy's a good time. So
Yes.
yes, yes. Thank you so much, guys. Thank you so much, Tracy. Thank you again for being here with us, sharing your insights. We appreciate you so much. Appreciate
No,
you.
thanks for the opportunity.
Yes. Guys, please feel free to join in the conversations. If you have any questions about community health workers, how to support community health workers, or do you already work with community health workers and you're looking for resources, feel free, reach out, join the conversation, especially in the asthma space. So, yes, that's like our bread and butter. So,
Yes.
feel free, guys. Thank you so much once again for being here with us, and know that we are growing together. Yes. Guys, RT Share Tea Podcast is available on most podcast platforms on Wednesdays, except for when I'm on vacation. or and on YouTube on Thursdays. So much more to come. Guys, I will see you next time. Bye.